Dr. Dina Kulik, pediatrician and founder of Kid Crew Medical, is joining us on the show. Dr. Kulik, thank you for your time. Appreciate it.
Of course.
There are some heartbreaking stories now that are coming from across the country with how kids are getting hospitalized. In BC, we know, unfortunately, 6 kids lost their lives because of the flu. Talk to us about the situation, what you're seeing with your clients.
Unfortunately, this situation is similar across the country and into the US as well. We are seeing very, very high numbers of influenza A in particular, RSV. There's still lots of cases of COVID out there. We are somewhat inundated throughout Ontario as well as across the country.
You know, there was a statistics I was going through which says that at this given point of time, there are more kids under the age of 5 who are in hospital versus adults above 65 because of the flu. And this is just the beginning of it all. What do you expect to happen as we go forward?
I wish I could say that this is the peak, but I think that's quite unlikely. I think as people get together for the holidays and as it gets colder outside, that's usually when we see a rise in viral illnesses. Because when we're indoors and we are in close quarters, we are often sharing lots of things, including respiratory viruses. So many of us are very concerned, and I think it's quite likely that we will have a rise in these illnesses before it gets under control.
The flu, as we know, doctor, has been described as an epidemic in the country already. But what is it about the flu this time that A, kids are getting affected more? And B, is there a circulation of many kinds of viruses in the flu? What do we know?
It's a great question, and I don't think we have a definitive answer yet. There are some thoughts that the influenza A, which is going around the most right now, is more virulent, easier to get, and also potentially causing more illness this year. There's also some thoughts that having previous COVID illness decreases your immunity and leads you to become more sick with influenza, but not all kids that are getting sick with influenza have had previous documented COVID infections. And I think it's also that there are so many viruses that are prevalent right now. It's not just influenza A, but there's lots of RSV, there's lots of COVID still, and then the normal viruses we see this time of year are circulating very highly as well. We're also indoors and we're not masked, and that can help spread viruses as well.
To that point, we're often indoors, we're not masked, we're looking at the holiday season coming in, more people going to each other's homes, celebrating this time of the year. What's your recommendation? Should there be masks indoors?
I think when possible, if you're older than 2, wearing a mask can be very helpful. It has basically no side effects wearing a mask other than temporary discomfort, but does a very good job at preventing the spread of viruses from me to you and you to me. When you're indoors, in school, in work settings, if you can wear a mask, I definitely encourage it. And very importantly, please stay home if you're sick. Don't go to events and indoors with others if you know that you are sick. Even just a very minor runny nose can lead to significant illness in others if they get that same virus from you. And please consider getting COVID vaccines and flu vaccines. These go a long way to prevent against severe illness.
All right, we'll leave it at that for now. Vaccine, of course, being an important part of the conversation. Like you said, Dr. Dina Kulik, pediatrician and founder of Kid Crew Medical, thank you for your time.